Malaysia has confirmed its first locally transmitted case of the novel coronavirus.
The Philippines has reported the first death.
Tonight, the virus has spread from China to 47 countries.
Iran's government has announced a spike in the number of coronavirus.
The U.S.
For the possibility that this pandemic could flare for 18 months.
Number of cases all across the U.S. topping 16,000 cases.
أعلنت وزارة الصحة الرصد وتسجيل 36 حالة.
It's a snow day. It's right to be worried about what's to come.
This is Dr. Sulaiman Al Habib-Arrayan Hospital, one of the most prestigious and modern hospital in the Kingdom of Saudi Arabia. Since the crisis started, every aspect of the institution was mobilized to quickly address the increasing number of cases admitted. The first confirmed case in the kingdom was announced by the Ministry of Health. Day by day, the numbers of confirmed cases are increasing with an alarming rate. To contain the spread of this highly infectious disease, and with the increasing demand for hospital beds, the medical ward was converted to COVID area, specifically to admit positive and confirmed cases. A simple good morning to start the shift are gone. With the combined efforts of the nursing, medical, and administrative team, a well-planned strategy was put into place. Confirmed cases continues to rise. COVID ward utilized the pedi ward for expansion. This eventually reached to PediaC and DSU. Coronavirus seems unstoppable. The frontline workers were not given enough time to prepare for the surge, and the hospital had to turn to coronavirus fighting zones. Emergency meetings are conducted by the nursing team and leaders on how to handle the crisis and to ensure quality care is given to all patients. They were very keen to their strategic plan. Strict health protocols were implemented with the guidance of the Nursing COVID-19 Crisis Committee and Infection Control Team.
Yes, we are taking care of our patients with COVID-19, and I am happy to be taking care of them with my colleagues. And also I'm happy about our nursing staff who are courageous and taking care of all the patients. So we are proud to be part of healthcare heroes who are taking care of those patients.
The question remains, how are the healthcare workers coping with this deadly virus? As mandated by the head of this department, following infection control restrictions, relatives and visitors are not allowed to enter beyond this red line. Disinfections were tightened from time to time. Here in this COVID area, the team leader is preparing protective gears for the upcoming nurses, ensuring all are ready and well equipped in fighting the unspotted enemy. The morning shift arrives and get ready for their duty. Here in this room, they put on complete personal protective gear. The importance of hand washing, hand hygiene, and appropriate bodysuits are essentials in their daily battle. Nurses are used to working long hours, but with the overwhelming cases and the need for the protective suits, physical, emotional, and psychological stress are main issue they are facing. The bodysuit, face mask, and face shield are necessary for protection, but it causes additional strain to nurses caring for COVID patients. Breathing can be very difficult, and the movement can be limited. Overall, where is more descriptive? All medical frontliners are working very hard and ready to go wherever their service are needed. As a healthcare worker, this can be a very difficult time and emotionally trying moment. The physical, emotional, and psychological risk hospital staff face during this pandemic can be very exhausting.
Suit is really hot, really. I'm sweating a lot inside. But it is important in taking care of the patients who are positive for COVID-19. So in order not to get sick, in order not to get infected from those patients, it is important to do proper PPEs, proper donning and proper doffing, proper hand hygiene, proper hand rubbing. It is really important in this area. So you should always have, this is the most important, you should always have presence of mind. Working here in a COVID area is, at first, I'm really afraid. I'm afraid of getting sick. I'm afraid of getting infected from those patients. I'm afraid that I might die and I may not be able to see my families in the Philippines. But as days goes by, it's fulfilling. It's worth it. It's worth it that you are able to fight this coronavirus. It's invisible enemy. So I'm proud to say I'm one of those nurses who are fighting this one. So I need to see my patients, so I need to get going. Bye.
I will do 16 swab, and all of them are confirmed cases. We will just repeat the swab. Some of them are negative. We want to confirm that they are negative, and some of them are just to repeat because they are not symptomatic anymore. And we want to make sure if the virus is gone in their body and they are not anymore contagious. That's the idea of repeating the swab. Okay, ladies?
The number of admissions are soaring. The colleagues were overwhelmed with the number of nurses infected. Shortage of healthcare worker case started. These nurses are working beyond their regular hours to take care of the coronavirus patients and helping doctors in carrying out their job effectively and efficiently. For some, the recovery was quick. Meanwhile, in ICU, everyone has been struggling to cope with patients with the disease. Resources were also stretched to the limit as the number of infected cases increased. This can be a bit challenging, as the protocols are defined and redefined according to the changing scenario of the hospital. Doctors are calling the family members, having a long discussion about likely outcomes, and listen to them while they sob, which they do not normally do. Here in ICUA, nurses faced the hardest and saddest day at work. 5 confirmed deaths was marked on this day. Emergency cardiac codes are common. Some people don't make it, but these nurses are resilient. The emotional and physical strain on these health workers are visible, and this situation can be really tough. Most of them are witnessing the most traumatic scenes of their career. This is where their psychological preparedness are tested. And to our colleagues who have sadly died of COVID-19, it was truly heartbreaking for us, but will always remain in our hearts forever.
As we know, COVID-19 on March it's reached to our country. So as HMG-Arrayan Hospital Intensive Care Unit, we take responsibility to be ready. We made our disaster plan and started immediately when we have started the COVID patient admitted to our hospital. For that, we have prepared our beds by increasing the capacity from 35 beds to 53 of intensive care unit beds. Out of this, 43 beds it was occupied by COVID patients. For that, we make the plan for training our staff from other departments like the endoscopy, OR, and OBD for almost 3 weeks by ICU program. And they started to handle and they supported us in that pandemic. Our admin, they supported us from our nursing and medical admin a lot. At the peak of COVID-19, we start to lose some patients as in other countries. It was a little bit stress and our staff. We supported them to pass this period. Then we have some success story. 2 pregnant ladies came admitted to ICU, intubated sick patient. They have delivered an LDR as post CS and they are discharged with their baby safely home. We hope that pandemic will be over soon and everything will go back to the normal, inshallah.
Here in PICU, dedicated to adult non-COVID cases, they too are facing similar dilemma. 2 emergency cardiac codes are happening at the same time. Both teams are doing their best to save the lives of these patients. After great effort, the patient died. While on the other side, this patient too didn't survive the battle. The sobbing families are the most excruciating sound that nurses hear.
Because of the pandemic, it was decided that PICU will be extended to receive adult patients, and that is because of the pandemic and the high flow of patients in our hospital. As it was documented a while ago, unfortunately we had 2 code blues and both of the patients did not make it. This pandemic and the situation that is universal and everyone is passing by, it's causing for us a lot of stress. It's difficult, but we will still try our best to overcome all of this, and as a team we can help to protect our community and to decrease the side effects of this disease. Also, we are doing our best to not only to protect our patients, we need also to protect our staff in order to be ready to serve the community at any time needed, and hopefully everyone will be safe and sound, and we will be ready at any time to help.
Meanwhile, the emergency room reached its critical turning point. Patients are coming in with a rapid increase. And because of the bed demands, the ER department started to accept critical COVID cases. Arriving to work each day, doctors and nurses are met with confusion and chaos. COVID-19 changes the ER and the instinct of it.
These days we are seeing a lot of patients of COVID. We are almost in the peak of the crisis. We are seeing patients of COVID with critical cases. They are intubated, but they are doing well, hemodynamically stable. ER staff are doing the maximum to help those patients by managing this crisis. They are wearing full PPE for a long time to help those patients. Many challenges. One of those challenges are bed availability. Always the hospital is full. And now, while I'm speaking, there is 8 patients admitted in ER as critical care. We are doing great efforts. ER staff, as a frontliner, are doing great efforts to manage this crisis, and inshallah everything will be okay soon.
In this COVID area, another patient didn't make it.
Today, we will have 1 patient died. After 15 cycles of resuscitation, sad to say, he died.
In a situation like this, the death of a patient is one of the most difficult moments for healthcare frontliners. It is nerve-wracking because they don't know what they will encounter on a given day.
So today we are in medical ward. We're dedicated to accept COVID positive patients, clear or confirmed. Being a nurse, this is one of the saddest moments. Having patient die during your shift, having cold flu, and then eventually patient cannot be revived. So this is part of our profession, and we have just to take it, accept the fact that even though we were suffering like this is part of our profession. Some of our patients who are expired, but there are many recoveries that we have. So discharging patients, increasing the recoveries of the patients, and sending them home with their families. This is one of our victory.
The most rewarding thing in these trying times are when patients get discharged.
Bye, sir!
Since this pandemic started and it was affecting all over the world, and as we are part of this frontliner, the OR elective cases was cancelled. So we need to support, as we are a team of the Sick Nursing Crisis Committee. We are stretching our staff to the maximum to send them out to support other areas like COVID area or ICUs, support the staff there. Since this pandemic, it's affecting all of us, and it's really giving us hard time as we never fight for this type of disease before. I want to appreciate all the frontliner, doctors, nurses, management, and the cleaner, because everyone has a role, and if we did not do it, we will not pass this one away. I hope it will never come back and it will stay in our memory.
COVID-19 actually changed our world. We fell asleep in one ward and we woke up in another one. The challenges we face during this pandemic is mainly the needed manpower to accommodate this high expansion of beds for these admitted patients. Then also the number of personal protective equipment and the consumption, which was increased in the whole world and mainly in the kingdom and in our hospital. The second one, that we have the lack of infection control staff. With this load of work, many diagnosed patients, we have to follow every other day the patients who are not admitted, and also the number of negative pressure room, the needs for more machines for better and faster environmental cleaning. I'd like to thank everyone in HMG with their contribution and hard work during this pandemic, and we are all in this together, even if we cannot hold hands right now.
Here in outpatient department, social distancing and limitation are essential tools to contain its spread. The high infectivity rate of COVID-19 has not only created health emergency to the most parts of the world, but overwhelmed the existing healthcare system of all countries alike. It is a challenge to know when to come back to work after being sick. OPD nurses were properly trained to conduct nasal swabbing to all staff who were previously infected before getting their fit to work clearance. And all medical workers who are returning back from their respective countries are getting tested and quarantined as well, and they must be asymptomatic before coming back to work. This is to ensure that all health workers are in good shape. After months of fighting the disease, the hospital slowly stabilized and returned to their normal phase. They are starting to see a decrease in cases. Their recovery rate is continuously rising, and the fatality rate has gone down, together with active cases. CCU was officially closed for COVID patients and shifted back as regular cardiac care unit. After a few months of admitting COVID patient, COVID Ward C is now officially back as a regular pedia unit. properly cleaned and disinfected, COVID Ward B is now finally back and operating as regular Pedia Bay unit.
All of us, we face a dangerous situation. The unseen enemy changed everything around us. We have met a lot of big challenges during this outbreak, such as staff manpower, department outbreak, staff fears, staff health condition, shortage of medical materials, absence of outsourced services, diversion of workload from area to area, and many other things to mention. Nothing written in books to follow, no references to read, no drill happened before to prepare. In fact, no one expects this to happen at all. We planned according to the current situation and made firm decisions. We did mistakes, but we learned from it. But as always, nursing team make the miracles. Through our brave nurses with high flexibility, teamwork, forecasting and proper planning to all scenarios, we able to survive and continue the job. From the bottom of my heart, thank you to all of you for your high dedication towards work, for being flexible and courageous in facing all of these challenges. You fought hard and stand for it. All of you accepted it without hesitation. To our dear nurses, thank you for choosing to serve and care for those that may be afflicted with the virus. You run towards the red line even though the mere act of caring for them may put yourself and your loved ones at risk. Thank you for being the helpers and heroes that everyone looks up to. You have chosen selflessness over self-preservation, not just today during this pandemic, but every time you step into your scraps. It's never easy work, and few will understand why we do it, but we charge on, ready to fight another day. This pandemic have been referred to as our new generation's world war, but rest assured that I and the rest of the team will work hand in hand all throughout this pandemic, and we will surely get through this together.
As I see it, the triumph here lies in the courage and humanity of healthcare workers. This may not be enough to defeat the virus, but it's magnificent to witness the resilience and heroic act of the frontliners. This pandemic taught us many things. It provided us windows of opportunity to learn from these difficult times, to identify the areas which in need of our attention that we have been neglecting. The COVID-19 outbreak has been an incredibly challenging time for all. But despite of these difficult experiences that we all encountered, everyone remained positive all throughout the battle and never doubted that we will surely overcome this crisis and return to normal lives. During this time and the given scale of problem, solidarity was being observed, that no one is left behind in this battle and we'll all stand together.
You're the engine that makes all things go, and you're always in disguise, my hero. I see your light in the dark, smile on my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, know I love you for that. Honest and selfless, I don't know if this helps it, but good job, you're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah.
6 in the morning. As soon as you walk through that door, everyone needs you again. The world's out of order. It's not a sound when you're not around.
All day on your feet, hard to keep that energy. I know when it feels like the end of the road, you don't let go, you just press forward. You're the engine that makes all things go. Always in disguise, my hero. I see a light in the dark, smile in my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, oh, I love you for that. Honest and selfless. I don't know if this helps it, but
good job, you're doing a good job, a good job.
Good job,
you're doing a good job. Don't get too down. The world needs you now. Know that you matter, matter, matter.
Good job, you're doing a good job, a good job. You're doing a good job. Don't get too down. The world needs you now. Know that you matter, matter, matter. Yeah. The mothers, the fathers, the teachers that reach us, strangers to friends that show up in the end. From the bottom to the top, the listeners that hear us. This is for you. You make me feel it. You're doing a good job, a good job. You're doing a good job. Don't get too down. The world needs you now. Know that you matter.
Thank you so much to our first responders, our healthcare workers.
We know it's been hard, but thank you.
Thank you. Thank you.
Thank you.
Thank you.
Thank you. Good job.
The fathers, the teachers that reach us, strangers to friends that show up in the end. From the bottom to the top, the listeners that hear us. This is for you. You make me feel it. You're doing a good job, a good job.
You're doing a good job, a good job. You're doing a good job. Don't get too down. The world needs you now. Know that you matter, 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 yeah. 6 in the morning. As soon as you walk through that door, everyone needs you again. The world's out of order. It's not a sound when you're not around.
All day on your feet, hard to keep that energy. I know when it feels like the end of the road, you don't let go, you just press forward. You're the engine that makes all things go. Always in disguise, my hero. I see a light in the dark, smile in my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, oh, I love you for that. Honest and selfless. I don't know if this helps it, but
good job, you're doing a good job, a good job.
Good job.